Strode, and welcome to Straightforward. Today I have a very lovely and brilliant guest, Monica Rhymes, and Monica is a nurse practitioner. She has traveled the world for a major corporation. Welcome, Monica.
Hi, thank you for having me.
Oh, no, it's truly my pleasure. I was so impressed. I met your mom, and of course your sister is one of the sponsors of this show. And they were so excited that you were going to come back and be based here, because you've been all over the United States working for a major corporation. And so now you're joining the family team as a nurse practitioner.
Yes.
Yeah. So after how many years you were on the road with a major corporation?
10 years.
10 years. And exactly what was your role? We won't say who that corporation is, but exactly what was your role and what did you do?
So I was the National Director of Advanced Practice Providers, and in that role, I had the ability to supervise all of the nurse practitioners and PAs that work for that corporation. So my territory was in Florida, Georgia, Texas.
Wow. Coast to
Chicago.
coast.
Yes.
And to the Midwest.
Yes.
And Chicago.
And South Carolina at one point.
Really?
So
Very cold climate to go from Florida to Chicago for people that's never been there.
yes.
And so you had to visit the clinics
yes.
and monitor what they were doing, or
Just quality control with the providers, ensuring that everyone provided the best care and following the best standards of practice. So that
Okay.
each patient had the best outcome.
so you have a lot of frequent flyer miles. You can donate to me and your mom, and we can go to Hawaii. And you had a lot of hotel stays.
Yes, yes.
Yeah, and so people think that's glamorous, but you learned firsthand that was not glamorous.
It's not. There's nothing like sleeping in your own bed at night, just walking into your own kitchen and
Right.
cooking, your own meals sometimes. So,
And so you have a puppy
yes.
who really is the boss of you.
Yes, Bella is my boss.
Okay.
She is my cane corso that I've
Okay.
had for 9 years.
9 years.
Yes.
So in traveling as a professional, you tried to take Bella.
I tried.
But Bella didn't understand, and she was spoiled, and she thought every hotel was all her territory.
Yes, the entire hotel. It's
Okay.
her territory.
So you probably didn't want to guess like me, because when you're a mature girl, you got to sleep when you can sleep. So I would have been calling the front desk about Miss Bella. So you had to start leaving Bella with family.
I did. I have a great next door neighbor.
Uh-huh.
She's Bella's second mom, and so
Okay.
I didn't even have to board her, so she was able to stay in her
Okay.
own home
Okay.
and be comfortable there.
Okay, so she wasn't in and out the airports, because I see people travel
Yeah.
with their pets. But you tried that, and then Bella was the belle of the ball.
Yes, she
Right.
was. Yes, absolutely.
Right. And so now you're going to join your sister
Yes.
at Whole Patient Healthcare.
Correct. Yes.
And so what is going to be your role there?
So I'm actually doing a dual role there
Okay.
at Whole Patient Healthcare because I have the corporate knowledge as to how to run a healthcare organization, the right things to do, as well as what not to do.
Right.
I'm able to offer that lens to her on an administrative role, as well as being able to help with the patient load. I'll also be helping her to open the new laboratory
Right.
in Whole Patient Healthcare, and be able to offer labs on site, as well as doing some occupational health services there.
Okay, so we're expanding.
Yes.
And I am happy to know that we are working toward getting the in-house lab,
Yes.
because I am a patient as well as my husband, and then we have to get our little progress report paper and go to another location.
Yes.
And then, we have to sit and wait there, and then they send it back to you all at that office. And then you gotta go to the principal's office when your paper is not good, when you come back for your doctor's visit. So at least that'll take some of the stress
Yes.
out of sitting at another location. So you all be able to do it in-house.
Yes, in-house. And not only will we process the labs, in-house, we'll also offer some point-of-care testing, which we currently don't provide.
Okay,
So
what
you're
is
able-
point of care?
So point-of-care is those tests that you get those results on the day of visit.
Okay.
So be it I check the glucose, run a strep test on you, COVID, flu, there's so many.
Okay,
tests out
so
there
now I know a new
immediately.
term, a point of care test
Yes.
in-house. Well, I think it's going to be just a wonderful, an addition, and you've learned at the corporate level across the country working with diverse
Yes.
communities? Because when you said to me, Texas, Florida, Chicago, even the Carolinas, for people that have not traveled, those cultures are very different.
Very.
The population, the demographics, all of that. Wherever we live here in Georgia, it looks different.
It does.
Right.
And even the patients that walk through the door, whole patients,
Mhm.
there is a mixture of cultures as well as lots of diversity that
Right.
you see there. So I had the pleasure of getting to know some of those patients and understanding their cultural needs. So it's been really exciting.
Yeah, and when you say understanding the cultural needs, because we're in the South,
Yes.
you've worked in the Midwest, and you worked in the West, and then further south. We like everything fried on Sunday. We want fried chicken. It's seasonal, but we want country fried corn. No, we do.
We do. We
want
love it. We
candy
love it.
yams. We want cornbread. Some other cultures, they might want tortillas
Yes.
and black beans.
Yes.
So it looks different.
It does, but you have to learn their diet, and I typically ask the patient, what do you eat? What is your favorite food? What is your comfort food? What do you turn to, when times get hard? What do you eat when you're happy? What do you eat when you're sad? And so that helps me to understand, where those deficits are, and to understand what their diet is. And moderation is key. To say forever, you can never have that fried piece of chicken. That's
Right.
unrealistic.
Right. People want to cheat.
Yes, yes. So
I'm a
whether I know it or
I'm a
not.
regular cheater, but the team there, a whole patient know I'm a regular cheater. So, but anyway, I'm doing better than I did last year, and I'm working on changing my behaviors. But it's kind of tough for a mature girl, but I'm gonna get there. But yeah, I like what you said. You gotta pay attention to what you eat when you're happy, and pay attention to what you eat when you're sad.
Yes.
And so my sad thing is, Dr. Ryan's note is Lay's potato chips. That's my grief trigger.
Which one?
The yellow bag. And it has to be the
All the
original.
folded ones, you have to give them to me, because I love the folded. The ones that are folded up,
Right.
those are my
Right,
favorite.
and so that's my thing because I don't smoke or, any of that, and that's my grief thing. So I had to learn to try to control that.
Yeah.
And then we realized it's because I like the crunch. And then David, the videographer here, because he knew when Dr. Rhymes was the guest, he tried to out me and brought a bag of chips and left it here. He was trying to get me in trouble, but she knew that it was just a joke. So anyway, that day it was, but I did cheat. So what we're gonna do is go to our sponsors and we'll be right back. We'll be right back after word from some of our sponsors. Straightforward is brought to you by State Senator Ed Harbison, serving the citizens of Georgia's 15th Senatorial District and on the front lines for veterans every day. Progressive Funeral Home, family owned and operated since 1952. The George Ford legacy of high standards continues today in the compassionate and professional services provided. A touch of dignity for those who care. Progressive Funeral Home, 4235 St. Mary's Road, trusted by generations. Whole Patient Healthcare. Dr. Jada Rhymes-Bacote is board certified in family medicine. She believes the best patient care includes practical, individualized lifestyle changes. Located at 1338 13th Avenue, Columbus, 706-641-2080, or visit wholepatienthealthcare.com. And welcome back to Straightforward. I'm really enjoying this visit with Monica Rhymes, and she is the nurse practitioner joining her sister, Dr. Jada Rhymes-Bacote at Whole Patient Healthcare, and it's going to be a one-stop shop, and I love it. But it's not a one-size-fits-all, because I am a patient there, my husband's a patient there, and you're talking about the time and the attention. She's not running an assembly line. She'll sit there and listen to what I have to say, hear me, and then try to address my concerns. Even down to, she wanted to know, because I told you the Lay's is my go-to food when I'm triggered with grief, who is my person that I call?
Yes.
I've never had that type of engagement with the doctor. It's like, so okay, so who you calling? And you just said to me in the first segment, I want to know what you're eating when you're happy, and I want to know what you're eating when you're sad. So that's very powerful. And so for our viewers, people need to pay attention to that, because it helps us Well, your mom did a fabulous job. She's a retired state employee and helped to get the business practice up and going. Just an amazing mom. I mean, just have done a fabulous job with you. Fabulous, brilliant women. But you attended school here in the state of Georgia.
I did.
Share with our audience what school you attended, and to our young people, sometimes a plan that you thought you had is not necessarily the way it's going to work out.
That is so true. So I really do believe in delayed but not denied.
Okay.
So initially, I did want to go to nursing school, and I ran into a few roadblocks when I went to Georgia Southern. So as I was waitlisted,
That's Georgia Southern
Georgia
here.
Southern University.
Okay, in Statesboro, Georgia. Okay.
Yeah, so while I was waiting to get into nursing school, I actually got a degree, bachelor's in community health. And with that degree, I was able to land an internship at the Centers for Disease Control and Prevention in Atlanta.
Mhm.
And I loved it, and I was offered a job there. And it was good money, but it just was not
It didn't
what I
fulfill that.
envisioned
Right.
for me.
Mhm.
And so I went and spoke with, some other nursing mentors, what avenue should I take, what could I do? And so I even thought about enrolling in the LPN program, and then maybe I could bridge over. But I went back to Georgia Southern to the nursing building, and I had a great lady there, Dr. Donna Hodnicki, and she advised me that I should seek other nursing programs. Georgia Southern was a great nursing program. I wanted to be there, but it was just very, very competitive. And so I applied at Middle Georgia State College
And
at
where
the
is that?
time. That was actually in Cochran, Georgia.
Okay, Cochran, Georgia. Okay.
Yes, but I attended the Dublin campus because I was living in Amelia, Georgia at the time.
Okay.
So I was able to complete my associates of registered nursing there. And so once I completed my associates of registered nursing, I went back to Georgia Southern.
Hello.
Yes, and I got my bachelor's. And while completing my bachelor's, the same mentor who advised me to apply to different nursing programs was there. And she convinced me that I needed to become a nurse practitioner. Well,
So now we have, what, 3 degrees already?
yeah,
We have a bachelor's and
we have two, we have a bachelor's and associates and another bachelor's.
and so now
Yes.
she wants you to go to some more
She
school.
wants me to go to school again.
Right.
So, I just, was going to turn in an assignment to complete my bachelor's, and she's telling me I need to come in the following Saturday to take the ACT test that's needed for admission into
Right.
the master's program. Well, I did not want to do it.
It's like, look, I've been to school 3 times. I got 3 degrees.
Yes. I
Right.
spoke with a friend, and she said, yeah, I'll come with you. I'm going to do it as well. She's another nurse. And so Saturday, she came and took the test. We were in class the first day of school, and I looked around. She's not there. not there.
Oh, and they're supposed to be in a team,
Because it
friend,
was
buddy,
supposed to
a
be,
buddy
yes,
pack.
her and I. But the blessing in that is that I met some really amazing people that to this day we are still friends. We built that camaraderie. And so sometimes, your path may not go as you planned it, and everybody that's you thought would be on that journey with you may not be there. But that does not mean that you're going in the wrong direction and that you shouldn't pursue where you're going, because there may be other people standing there waiting for you to take them in. So,
See, that is a very powerful story. A lot of our young people now, we're at that time of the year where they're, going to be selecting which college. Some of them, what they think their major will be.
yes.
As I shared with you, I used to be a social worker, and that's what my credential is, but here I am. And so we have to be willing to walk through the door that's open for us.
Yes.
And it's not necessarily easy, because here you are, you had a bachelor's, then you had an associate's, then you was getting another bachelor's, and somebody said, go to school some more, and you're like, really? But you had to be willing to take good counsel.
Yes.
Yeah.
And I still didn't learn, because I went back to the University of Colorado and I got my doctorate of nursing practice.
Well, that explains, your mother is such an academic. So you all, this family that just love books. You all love to learn.
Yes, we love to read, love
Right,
to learn.
yes.
My grandmother, my mom's mother, so it's ingrained with her. Growing up, it was never, are you going to college? The question is, which college are you going to?
Right.
So,
And it wasn't a limit on how many times you could go to college.
there was not.
So then you got the doctorate.
Yes.
children, we don't always kind of know what they're thinking. Now, when they're young, you can kind of sway them, but then you're going for another degree. It's like, okay, which she's big on education, I know that, because I've had lengthy conversations with her, but it's like, so we're doing this again? Did you explain to her?
I did
Okay.
explain to her because I knew that with the doctorate of nursing practice, I would have the ability in leadership through nursing and leadership as a nurse practitioner. So as a nurse practitioner practicing, I can touch, X number of patients.
Right.
But in a leadership position, guiding, 50 nurse practitioners, you can multiply that number that I did alone by those 50 people. So that really extends your reach. You really can help improve a greater number of patients with your outcomes.
Okay, and so that's the thing that our young people have to be told. Sometimes people get a degree and they really don't know why they're getting it, and I did work at Andrew College. Some kids came to college because that's what their parents told them to do, and they never even had a major when it was time to graduate. Okay, so but you understood that that would help you on the leadership side.
Yes.
So you had all of that clinical,
Yes.
but it was going to afford you the opportunity to work corporate
Yes.
and be able to oversee and manage others in the
Yes,
medical.
yes, and because mentorship and leadership is so important within the healthcare field. So nurse practitioners, we fall in a unique
Yes.
niche of healthcare. The state of Georgia does not allow us to practice without a collaborating physician. I mean, the physicians can only have, it's four, might have changed to 6 now, nurse practitioners in which they supervise.
Right.
And so they're required to review those charts of those nurse practitioners and just make sure that we are, doing everything by the book. So
Okay.
there are some states that allow independent practice.
Right.
Georgia is not one of those.
Okay.
And I would say I love the collaboration with the physicians.
Right.
Just because I respect the amount of training and
Time
that they put in
Right.
for the learning. And so
Okay.
that extra set of eyes and that expertise, it really does help the patient out.
All right. Powerful. What we're going to do is go to a break to our sponsors, and we'll be right back. We'll be right back after word from some of our sponsors. Columbus Pediatrics GA, working together to build lifelong relationships between our staff and patients by consistently providing compassion, excellence, and value with 2 locations. The Old Town office at 3580 Massey Lane, Suite F, 706-596-8667. The Midtown office, 1900 11th Avenue, Suite A, 706-323-3400, ColumbusPediatricsGA.com. Barbara's Cleaning Service, a 5-star commercial service with satisfied customers in Georgia and South Carolina, built on the principle that every detail matters. Barbara's Cleaning Service, a new season building a family legacy. The Autism Hope Center. Diane Pope has dedicated the last 3 decades ensuring that families had support and resources for their loved ones on the autism spectrum. Join the Autism Hope Center for fellowship and resources located at 200 Hamilton Road, Suite B, or call 706-604-6333. The Miley Agency, Gerald Miley and his team can assist you in every aspect of your insurance needs. Call today for your free quote at 706-996-2045 or visit themiley.agency.com. And welcome back to Straightforward. I truly am enjoying this amazing visit with Monica Rhymes, nurse practitioner, joining Whole Patient Healthcare, and her sister, Dr. Jada Rhymes McCoat, has traveled and trained all over the U.S. A very powerful story to our young people as we're nearing graduation. People have to make college selections. It's important to know that just because you have a plan when you enter college does not necessarily mean that is where your path will end. And you have to be flexible in that. I had a friend of mine as a guest on a previous show, and he thought he wanted to be an accountant, but a very talented artist. He had an educator to gently direct him back to art. But in his mind, he thought accounting was his thing. Yeah, then I said to him, well, you'll be able to count your money. But that wasn't what your calling was. And so you gotta work, and if you're working and operating in your gift, it shows. And I just want to say, this is the most time I've spent with you. And it shows. No, you're very knowledgeable, you're very confident, and then you knew why you were doing certain things. You had a good mentor. And you didn't get offended when she said, no, you might need to do this. Look somewhere else. You didn't take it, you were not defeated. You took it as positive feedback.
Yes.
And so we have to train our young people to know that. Sometimes people might not say what you want to hear, but it could be for your good. What you need to hear. Yeah. So the team there, will you be responsible for training the team? I know the team is growing because when we first started, we didn't have all the staff we have there now.
Correct.
And so you'll be having some oversight. I know y'all have an office manager, but since you're being quality control for this major corporation.
I will be in charge of all of our compliance and making sure that we are, following the standard, well, above the standard. To me, the standard is,
Too low.
it's too low.
Well, that's your family.
So-
All of you all are here to show just the bottom line. Just spend 5 minutes with your mother, you know that we will not be average or anything. Yes, so, but the vision, so you all plan to grow?
Yes,
Been there
we are
2 years.
growing. We are growing.
Yes.
So when we say whole patient, that's
Mhm.
exactly what we mean, the entire patient.
Mhm.
So we are looking to not only, treat the patient, their physical well-being. I'm also going to look into like branching into some counseling services
Oh,
as
great.
well.
Mhm.
And recently I've become certified in aesthetics. So, because
I tell you.
that is a part of the whole patient. Your
It
reflection
is.
is a part of
It
it.
is, but
So-
I have to laugh, Monica, because your mom, your sister, you all love learning.
Yeah.
And I'm excited about
And
that.
as much as I love learning, I love teaching. I
Yes.
love sharing what I've learned.
Yes.
I enjoy precepting, mentoring. Just hang out with me. If I know something, let me
Share.
If you're willing to learn, I love to teach.
See, and that's the kind of circle I want to be in. But when you said something about the aesthetics,
Yes.
because I know children, and I work with children in my other life, where they had a skin problem,
Yes.
and it worked on their self-esteem,
Correct.
and they were often bullied,
Yes.
and their parents couldn't always afford for them to go to the dermatologist. So at Whole Patient Healthcare, you all take people from this end of the spectrum to over here, get past my group to 100, as Dr. Rhymes would say. But a lot of that, we have seniors that have skin disorders, eczema, all of those things. And so if it's on a girl's face and she's 20, you're going to be able to address that with her.
So it depends on what exactly is going on with her. Because, it's dermatologic, we have to send her to a dermatologist.
Right.
But if there are just some imperfections or things that have always bothered her, she wants to get fixed, we'll be able to do that right there in the office for her.
Right, like
down.
some of those molds that.
Yeah, mold removals,
Right.
Laser hair removal. Some
Mhm.
women have issues with that.
Oh, I
as
do,
well.
I have a lot of that, right.
Yeah.
In the old days, we called it Harry. People are Harry, really, that was a Southern old term that people would use, but those are things that you all will be able to use.
Yes, and then, sometimes as we age, we lose the collagen in our lips. And
Yes.
So just, some people just want just a little filler,
Mhm.
feel like themselves. So you'd be surprised at some of the things, that are bothering people. Their
Mhm.
depression is their reflection
Right.
of themselves.
So the depression is from the reflection
It
of
can
this.
be.
Oh, I know.
sometimes, yeah.
Yeah, because you have to be able to grow old gracefully.
Yes.
Right.
And we're not trying to change, you're not gonna be 20 again, but
Right.
yeah, we can
Right.
help ease some of those hard lines and different things, just to help you feel more beautiful, more confident.
My goodness, so now we have another prediction. So, do you all have a wall at your mom's house where y'all just have all of this, all of these
She does have
education?
a room with everybody's college degrees.
I would think so.
Yes.
I would think, because she's very about education. And every time when she was there at the practice, we had those conversations.
Yes.
And I knew that even as a state employee, she expected excellence. And, and that was just serving sometimes the least of them. She expected excellence. And then even with the team there, she always wanted people to be at 110%. And, even when you walk in the building, you can see everything is so color coordinated. To my husband, the first thing, I said, no, that speaks. First impression. It
Yes,
really does.
it does.
It does. So, offer, do you speak to students? Can we book you in the community to go talk a career day? Because you know I'm famous for doing that to people. But I think your story is very powerful, it is very useful. And you didn't come from a trust fund family, you just came from a hardworking family.
Correct.
Right.
And, go a little bit deeper than that. I was a teenage mom.
Really?
So I had that, barrier as well. So I haven't lately, but I'd be happy to start back mentoring young girls and helping them, along that way. Hopefully, it's not some that are teen mothers.
Right.
There's so much access to contraception now.
Right.
I'd be happy to talk to them about
Okay.
that and prevent that. Not
Okay.
a road I would advise anybody to go down.
Right.
But with the support of my mom and my family,
Mhm.
I was able to continue my journey and my education. That's where I am now. And so,
With all these degrees.
yes, ma'am.
Excellence and beautiful and brilliant. Well, I want to thank you so much, and now that you've shared that with me, be warned. I will call you.
Please.
I will text you because I think it's important that young women see women like you and know that it's possible.
Yes.
And sometimes we take a detour, but a detour is not necessarily a stop sign. Right. So I'm expecting great things. I'm excited. I'll be coming to whole patient healthcare. Hopefully I'll lose 1 pound before I come back to me. I'm not into it very good, but I promise you I'm going to try. And I thank you so much for taking time to come and sit with us, but also for coming back and joining the whole patient healthcare family. Because you could be all over the world, but we need you here. All right. Thank you.
Thank you.
All right, we'll do it again.
Yes.
All right. This has been straightforward. If you don't stand for something, you will fall for anything. Until next time, be blessed.
What up, world? What's up, Columbus? Be sure to tune in every Sunday, Straightforward with Gloria Strode, right here on NBC 38.